3 months ago, Mary Jane, a 27-year-old female, came into the clinic for a scheduled appointment and everything was fine. Over the past couple months, she has stated she's lost weight and is feeling very fatigued and nervous. Recently, she has been intolerant to heat, has been having palpitations, and is sweating lots. After a series of blood tests that revealed low TSH levels, an EKG, and a more thorough physical examination, Mary Jane is diagnosed with Graves' disease.
Graves' disease? What's that?
Graves' disease is excessive stimulation of the thyroid gland and is an autoimmune disorder. To explain how Graves' disease affects the body, it is beneficial to first explain how the body works normally under homeostatic conditions. The thyroid uses a negative feedback loop. The hypothalamus releases thyroid-releasing hormone, which then stimulates the anterior pituitary to release thyroid-stimulating hormone. The thyroid is stimulated by TSH and then releases T4 and T3. Both hormones are made in the thyroid with the presence of dietary iodine and an amino acid called tyrosine. Once these are produced, they travel through the blood by binding onto a protein called thyroid binding protein. This protein transports the hormones throughout the body to body cells. T3 is the active form of the thyroid hormones, and once at the cell, it binds to a thyroid hormone receptor. Crossing the cell membrane, T3 enters the cell nucleus and increases protein synthesis within the cell, which then increases its metabolism. Increasing the metabolism facilitates breakdown of organic molecules, stimulates heat production, and stimulates glucose production. When the body detects increased levels of T4 and T3, TSH and TRH are suppressed, therefore leading to a decrease in T4 and T3. So this is how the thyroid is supposed to work normally. Let's see what happens with Graves' disease.
Because Graves' disease is an autoimmune disease, the body is attacking itself. In Graves' disease, there's an excess production of thyroid hormones, particularly T3, which leads to hyperthyroidism. In Graves' disease, helper T cells become sensitized to antigens within the thyroid gland, particularly the TSH receptors on the thyroid follicular cells. When the helper T cells become sensitized, they stimulate B cells, which produce antibodies to the TSH receptors. The autoantibodies that are created by B cells are called thyroid-stimulating immunoglobulins, or TSIs, and they prevent TSH from binding to the receptor normally. These autoantibodies mimic the actions of TSH by binding and activating TSH receptors, which result in increased synthesis and release of thyroid hormones and hypertrophy of the thyroid follicular cells. This hypertrophy of the thyroid follicular cells causes the swelling of the neck, which is also known as goiter. Because the body is in a constant state of high metabolism, weight loss, fatigue, sweating, and other related symptoms are all understandable.
Ophthalmopathy is a common symptom seen in 1/3 of Graves' disease patients. It is thought to result from cytokine-mediated activation of fibroblasts in orbital tissue behind the eyeball. Humoral autoimmunity is also important. Ophthalmic immunoglobulin may aggravate lymphatic infiltration of the extraocular muscles. After the eyeballs have protruded, many other complications may arise if not treated, such as corneal ulceration, which occurs when the eyelids cannot close over the eye. With treatment of hyperthyroidism, the complications associated with ophthalmopathy are prevented. Graves' disease is a form of hyperthyroidism and affects women 10 times more likely than men and is onset in early 20s. In summary, the 3 key concepts, proteins, cell membranes, and homeostasis, are all affected within Graves' disease.
The autoantibodies produced by B cells mimic TSH and are proteins that bind to the thyroid follicular cells, causing overproduction of hormones. The excess hormones then bind to receptors in our cell membranes of body cells, causing increased metabolism.
Because there is an overstimulation of the thyroid, it alters homeostasis within the body. After the explanation of the condition, Mary Jane has been given antithyroid medication. This medication reduces the antibody binding to decrease stimulation of the thyroid gland and help return the body